Hi, this is Dr. Padda. I want to talk a little bit about processed food addiction and why it's so relevant for chronic pain patients. I can tell you statistically, in our clinic, over 98% of patients that come in have metabolic inflammation. It's actually 99.5%. And over 98% of them have a processed food addiction. And why is this relevant? And why is it important to figure out? Well, first of all, it's important to even understand what a processed food addiction is. Processed food is the hyper-processed material that we get from the grocery store or from the convenience store or from a fast food restaurant. It has a lot of hidden sugars in it. It has a lot of carbohydrates. It has a lot of vegetable oil. And it has emulsifiers and chemicals and dyes and things of that nature. And all of these things combine to create something called insulin resistance. They combine to create severe metabolic inflammation. And when that happens, we become pre-diabetic. We become sarcopenically wasted. We start to get cognitive decline. We start to have a whole host of secondary side effects. And so a lot of patients go, well, how do you know that I have a processed food addiction? And so just the simple stuff that we pick up as we talk to patients, and what we're looking at is, what we're trying to figure out is, has the patient eaten more food than they intended in the last year? Have they spent more time thinking about it? Have they spent more time eating than they intended to do? Have they neglected something that they were supposed to do because they were overeating? So, this could be as simple as, I had a couple of extra meals in that day, or I focus my life in on having snacks because I get hungry every 2 hours. That's not how human beings are supposed to be. They're supposed to have long gaps of time between feeding. And I know what my nutritionist colleagues say, 3 meals and 2 snacks. And I have to tell you, that's absolutely wrong. You do not need 3 meals and 2 snacks and a whole host of juices and sugar-sweetened beverages to be okay. You effectively, even if you lived 100 years ago, you'd probably be getting maybe 2 or 3 meals and no snacks. And your food would have very little processing in it. You wouldn't get the emulsifiers. You wouldn't get the vegetable oils. You wouldn't get the high carbohydrates that are refined. You wouldn't get all of these dyes. We have over 4,000 compounds that we add to processed food to make it more palatable for us. And our food engineers have figured out how to make things much more addictive than they used to be. So what we have is a malnutrition of excess. Our food has way too much sugar, way too much vegetable oil, way too much other stuff, and it doesn't have the things it needs. Like, it doesn't have certain minerals, it doesn't have the vitamins, and our body has been tricked into eating this food that we don't necessarily eat or need to eat. So one of the other questions that we ask our patients is, have you tried to cut down on what you're eating in the last year? And sometimes patients find that they hide food from their family. They hide food from their friends. They hide it even from themselves, hiding food in places so they can get to it later. They get preoccupied by a particular meal. They'll get a trigger on the television that shows them a commercial for a fast food restaurant, and their mouth starts to salivate. They get sad, or they get angry. They use food to relieve those other symptoms, and they're substituting, and it's called hedonic substitution. So all of these questions, have you eaten more than you intended? Have you neglected something that you're supposed to do? Have you felt like you needed to cut down? Have you hidden your eating habits? Have you ever been preoccupied or wanting food processed to consume? Have you ever used food to relieve emotional pain or some other issue that you're dealing with? All of these are part of a questionnaire that we quickly get through with our patients. And even if you have 2 or 3 of these issues, you have a processed food addiction. And I can tell you that just from a clinical standpoint, the vast majority of patients with chronic pain have that. And our goal is to get that reversed for them, because if we can reduce their hedonic substitution, we can reduce their metabolic inflammation. And how does that work? I mean, patients have asked me, well, why is it that it's such a big deal? And I'm going to explain it in as simple as I can. So the more carbohydrate that we take in, the more vegetable oil we take in, the greater the insulin that gets secreted. Now, if you remember, insulin is something that clears blood sugar out of our bloodstream and puts it into our liver and into our muscle as glycogen. But if we don't exercise, if we don't move that much, if we're in chronic pain, and we're not having activity on a day-to-day basis. Our glycogen storage is full because it can only hold a limited amount. So everything else that gets stored as fat. And that wouldn't be a big deal, except that the fat, especially the fat around our gut, it's called visceral fat, that fat releases a compound called leptin. Leptin is something that goes to your brain and tells you, hey, I'm full. But the problem is that we get leptin resistant if we produce too much leptin. And when we get leptin resistant, our body doesn't know it's full. But the interesting thing is that leptin is a cytokine. So it's more than just your fullness hormone. It also is a potent inflammatory cytokine, and it causes migration of white blood cells and other inflammatory material to areas of our body and causes diffuse pain throughout because our white blood cell counts go up, our inflammatory mediators go up, and it makes everything hurt. And it creates a cascade of effect where we have too much leptin being produced all of the time. And because most people in America eat from sun up to sundown because they're constantly hungry, because they've lost their ability to regulate because they're leptin resistant, they never know that they're full, that's what we have to reverse. So that's what we end up spending a lot of our time having patients understand, that it's a processed food addiction that's triggering a lot of this underlying stuff, and we have to get that fixed. We have a whole host of methods and on how we help our pain patients break free from that addiction. If you have any questions, we have a checklist for this, and certainly reach out to me and we can chat while we're in clinic together. If you're not a patient of ours, I'm happy to answer some general questions. But again, we have a checklist, and that checklist is to provide additional information and context. Thanks so much. Hi.